Hi there. My name is Olga Jimenez. Welcome. Today I will be talking about postpartum depression. So imagine you've been waiting almost a year for your precious one to make their grand debut. Your excitement is undeniable, from buying their first onesie to decorating the nursery. Finally, your precious baby arrives, and suddenly those feelings turn to sadness and emptiness. Postpartum depression is common and it may affect somebody you know and love. I researched PPD after my first pregnancy and I dug a little deeper after my second. Today, I will be informing you of what postpartum depression is, possible cause, we'll review symptoms. Two different types of postpartum depression will be discussed: postpartum blues and postpartum psychosis, and then we'll talk about some treatment options. So first off, are you familiar with the term postpartum depression? What is it? Postpartum depression, also known as PPD, is a mental health illness and it affects women after childbirth. It can alter one's mental, emotional, and behavioral state. PPD does not have an exact known cause, but hormones are believed to play a factor. So during pregnancy, your body has increased levels of estrogen and progesterone. Now, within 24 hours after giving birth, those levels are going to rapidly decrease to a pre-pregnancy state. It is believed that this rapid drop can result to PPD. Some symptoms are often feeling sad or depressed, loss of appetite, loss of energy, and just not feeling an attachment to baby. PPD symptoms are more than feelings of exhaustion or being overwhelmed, as they negatively impact your daily living. So when you hear somebody referencing PPD, what is it that comes to mind? Perhaps an image of a loved one that you know who suffered from postpartum depression. Or maybe it's a news story about a mom that went crazy and hurt her baby. Now, it's important to note that PPD is loosely used as a blanket phrase, which is to include different types of postpartum depression, and there are actually many. The two you may be familiar with are postpartum blues, which is baby blues, and postpartum psychosis, and those are the two I'll be reviewing now. Postpartum blues, also known as baby blues, is the most common and mildest form of postpartum depression and can occur within days of childbirth. Mom may have feelings of sadness, irritability, and anxiety, just to name a few. Baby blues is expected to resolve within weeks on its own. According to Dr. Kimberly Langdon, medical editor of postpartumdepression.org, approximately 70 to 80% of women will experience at minimum the baby blues. Unfortunately, some women do suffer on a greater scale. Now, although rare, postpartum psychosis may involve psychotic symptoms such as delusions and hallucinations. This level of PPD does require treatment. It will not go away on its own. According to postpartum.net, research suggests they see a 5% suicide rate in moms and a 4% infant death rate. So now that we have an overview of what postpartum depression is it treatable? And the answer is yes. So according to Dr. Lauren Osborne, who is the Assistant Director of Johns Hopkins Women's Mood Disorder Center, antidepressants and other medications may be used depending on the severity of the mood disorder. So breastfeeding may still be an option, and that's very important to know because that may be one of the things that deters some moms from seeking treatment, not being able to breastfeed their baby if they're on these medications. Different types of therapy may be effective in some cases, and these include cognitive behavioral therapy and interpersonal therapy. Without a diagnosis, proper treatment cannot be rendered. So it's important to speak to your doctor about any concerns that you may have. If left untreated, PPD may last for months and even years. Now remember, education is key. It is important to understand what PPD is, how it may affect you. There may be different types of postpartum depression that you're going to go ahead and familiarize yourself with. But just remember, regardless of the type of PPD, the severity or less severe treatment is possible. Speak with your doctor if you have any questions or concerns during or after your pregnancy. Thank you so much for joining me today. I know I stumbled a little bit in the end there, but I hope that I was able to give you a little more information so that you are more familiar with postpartum depression. You enjoy the rest of your day.